Om Dhanvantari Namaha.
Shri Gurubhyo Namaha.
A very warm welcome to this absolutely wonderful session that brings together so many special people like you. I'm Dr. Ishwari,
I'm Dr. Meghanati.
and today we have the pleasure of being host with this webinar on Ayurveda practice organized by Team Ayuryana.
With humility and respect, I bow down to all river gurus and esteemed guests present here today. It's my honor to welcome our distinguished guests, the organizers, and our enthusiastic audience to today's session. Doctor, over the past fortnight, we are getting updates about webinar series by Ayuryana. Will you please introduce what it is?
Sure. Ayurveda is a holistic platform that brings together diverse activities, fostering a unique blend of learning, exploration, and community engagement. Its initiatives includes online and offline classes and workshops, informative artic- articles and help tips, health-focused camps and events, recreation activities and excursion for students, individuals with physical challenges, seniors and general public. Sustainable tourism programs such as ecotourism and agritourism. Ayuryana proudly blend tradition with innovation, events and activities incorporate traditional practices, local cuisines, and rural games. It inspired by the timeless principles of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a rich tapestry of heritage and wellness.
Wow, it's very nice to hear about it.
Now it's time to unlock webinar series. Will you please introduce what it is?
Yeah, it's my honor. Ayurveda free webinar series on Ayurveda practice planned to conduct on every Saturday for an hour. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship.
Oh, very creative and interesting it is. Doctor, I'm eagerly waiting to know the today's speaker. Please introduce.
Shubhayu. Vaidya Sharad kumar from Shikaripura. Sir completed BMS from SDM Udupi and PG from SDM Asan in Samhita and Siddhanta department. Currently, Sir serves as a assistant professor at SDM College of Ayurveda Asan and is pursuing his PhD from Government College of Ayurveda Mysuru. His academic contribution extends to his roles as Syllabus Committee Expert Member for Samhita Adhyayana 1 selected by NCISM and also Syllabus Coordinator for Samhita Adhyayana 2, and Sir is the youngest member to work in Syllabus Committee. Sir also received prestigious awards like Agnivesha Award given by SDM Asan of College and second prize in national level Swachh Bharata summer internship, which was received in Vigyan Bhavan Delhi, which was presided by then President of India Sri Ramnath Kovind sir. Youth icon in the Ayurveda Kumbh event held in Ayodhya in 2022. Sir also a short film maker and his short film Dr. Ayu has received Best Short Film Award in 9th World Ayurveda Congress held in Goa. Sir is the founder of Aptas Ayurveda Trust with the motto Reach Ayurveda to Each, which has 1K plus members across India. Dr. Sharad Sir has founded and directed impactful initiatives including Charaka Jayanti celebrations such as Charaka for Immunity, My Love for Charaka, Charaka for One Earth, Ayurgrama and Ayurgrama 2.0. Sir has given 25 plus guest lecturers on skill development in Ayurveda. Sir has organized Drudabala residential camp for 100 plus Ayurveda students. This year, Sir also organized a national level seminar on Ayurveda cosmetology and trichology. That is Punavasu, where 800 plus delegates have attended. A very warm welcome to you, sir.
So, no more late. Let us meet a very visionary leader who embodies the perfect blend of motivation, creativity, expertise, and accomplished Ayurveda practitioner. His dedication, passion, and leadership have created a profound impact, empowering individuals to embrace the timeless principles of Ayurveda. Let us bring our journey of knowledge and insight together. I request audience to drop your doubts on the chat box. Ourselves will clarify at the end. I once again welcome you, sir, and the mic is yours.
Hello, Namaste. Am I audible?
Yes, sir.
Whether my screen is visible? Is it shared?
Yes, sir.
Okay, thank you. So, welcome all to the Ayuryana webinar series. So, I'm really happy to share some of my views and ideas to all the uh, members who are joined for this webinar series. So, many might have thought, what is this topic, Asamarthata Bhayakaranam? So you might be expecting some entrepreneurship skills or skill development, such kind of thoughts. But my title is Asamarthata Bhayakaranam. So definitely we'll explore this. So when I say Ayurveda, there are different sectors related to this. It might be education sector, it might be being practitioner, it might be administration posts, or you might work in the research, or you might work in the pharma industry. These are different sectors where anyone who has got the degree in Ayurveda can work on. But to work in any of this sector, you should be having the competency. So that is called as Samarthata. And if you see in Charaka Samhita, there is a famous quote mentioned by Acharya Charaka, that is Asamarthata Bhayakaranam. So Asamarthata means Akshamata, Ayogyata, or Shaktihinata. Again, Bhaya means Atanka or Shanka. So whenever you inquire with our Ayurveda graduates, if I speak on all the sectors, we are having a lot of lacunas, be it education, being it Ayurveda practice, be it research, or be it pharma industry. Everywhere we have lacunas, and these lacunas are there in the graduates who are working in these sectors. So whenever you are not having the competency, it will leads to the fear. So how we can take over this problem, and how we can go into the depth of this problem, and how we can find a solution for this. So you might have inquired whenever you discuss with Ayurveda graduates. So once they complete internship, they'll be having these questions in their mind. If they want to get for post graduation, they might be thinking whether to go for clinical or to go for non-clinical. This confusions will be there, and whether to read for knowledge or whether to need for degree. These all thoughts are there in the student's mind. And the biggest thought what is running in everyone's mind is whether to practice Ayurveda or to practice allopathy. Most of the students definitely love Ayurveda, but when it comes to the point of making money, students are going towards allopathy and they are practicing allopathy. And this is the biggest challenge what even Aptas Ayurveda is trying to find solution for. Because whenever we inquire students, if you see in a class of 100, not even 10 students are practicing Ayurveda. This is the problem we are having in Ayurveda section. So the problem is asamarthata, we call it as incompetence, and the solution is samarthata. And the biggest problem with Ayurveda graduates is they think and they keep on discussing about the problems rather than finding the solutions. So today in this session, the whole thought, whatever I am discussing is how we can move towards samarthata from the point of asamarthata. How we can make our Ayurveda graduates competent enough to face the challenges in the global world, and how we can reach Ayurveda to each. So these will be the thoughts in my presentation. So the whole idea of Asamarthata Bhayakaranam is how we can remove this Asamarthata and how we can reduce the Bhaya. So let us discuss with the problems first. So the problems in Ayurveda education. So I'm not just discussing only problems in this session. Definitely we are seeing the solution also. But before solution, we should be knowing the problems what we are facing. So the problems in Ayurveda education is only theory and no practical. So if you now, as per the NCSM norms, new changes are made in syllabus considering these problems. So today you might be seeing that in the collegiate education, non-lecture hour was introduced where students are doing a lot of practicals. Still, if you ask with the students, most of them believe that there are more theoretical things than practical, and teachers don't know themselves about many topics. If you go throughout the Karnataka as well as throughout India, in most of the colleges, you will get teachers who don't know themselves about so many topics. So they might be merely translating the things, whatever is available in that subject, and no proper assessment methods. So this is the biggest problem with Ayurveda education. You might be teaching so many things, but our assessment methods are very poor. We are doing only exam and viva, how vivas are taking place in Ayurveda colleges. So this is the problem. So there are no proper assessment methods for the Ayurveda education and no skill development. If you ask any student who is studying in internship, and if you ask them to list the skills they have developed over these 4 to 5 years, hardly they will mention five skills. Not generalizing, again, there are good students as well, but the majority is not having this skill development and no guidance on teachers training. Even teachers are also having a lot of issues with education and no questions in mind of students. So the Indian knowledge system is based on questions and answer. If you even see the Charaka Samhita, Agnivesha keeps on asking questions and Punarvasu Atreya goes on answering them, and this is how the knowledge is imparted. But if you ask with the present students, they don't have a lot of questions in their mind because the past 12 years of modern education system have made them not to have a lot of questions. They just keep on accepting whatever is served to them. So this has to be changed. These are all the problems in Ayurveda education, and no curiosity to learn among students. If you inquire students, they are not curious about so many things. In a class, you will get most of the students who are in their own comfort zone and those who are enjoying their own pleasures by doing things which are not useful for their future. And if you ask them, they're not even curious about anything related to Ayurveda. The majority of students are like that. So these are the problems in Ayurveda education. And if I go on speaking about the practice, if you ask students what you are going to do after internship, most of them will say they will practice allopathy, or they start practicing that allopathy priorly before completion of internship also. And if you ask why they are not practicing Ayurveda, then they will say lack of confidence. You can observe that lack of confidence, and the biggest problem is lack of faith in the science. Unless you have faith in Ayurveda, you cannot practice it. And degree-oriented education have made them not to study these things in depth, and attraction for modern medicine, expecting everything without efforts. This is the biggest problem in Ayurveda students. They want everything but without efforts. So they have to put efforts to get so many things. So Ayurveda is easily available for those who are ready to put a lot of efforts. Initially, you have to put efforts, or else you're not going to see the fruits in that. And dependency on others. Our education system has made us so like that we are dependent on so many things for so many people. So this dependence is also there, which is making not to practice Ayurveda. So if you see current Ayurveda education system, as we know the concept of Chikitsa Chatushpada, I have designed something called as Chatushpada of Ayurveda education. So in Chikitsa Chatushpada, Bishak, Dravya, Upasthata and Rogi are the four pillars by which the Chikitsa will become success. In the same way, if you derive for Ayurveda education, the four pillars are NCSM, student, college management, as well as teacher. And if there is problem in any one sector also, the education will be not fruitful. But today we are in the golden age of Ayurveda, I must be very proud to say that NCSM has brought a lot of changes by which students are getting interest into the Ayurveda, but still we have not seen the outcome as these changes are made recently. So to see the changes of all the syllabus as well as so many things, we have to wait for at least 5 years. And when I was a part of syllabus committee member, I came to know that NCSM has planned all the changes in the syllabus, keeping the demands in the 2030 and onwards. So what are the skills required for a doctor in 2030 and further? So such things has been incorporated into syllabus and that has been designed. So this is Ayurveda education system. So still I'm discussing on different problems and we'll get some references in the Sushrita Samhita also. If somebody is lot of interested in theory, that is also of no use. If somebody is lot of interested in practicals, even that is also of no use. To be a good practitioner and to practice Ayurveda, you should be very good both theoretically as well as practically. So Acharya Sushruta has given a nice simile: a bird with one wing cannot fly, so to fly, a bird require both the wings. In the same way, if you want to achieve success in Ayurveda, if you are only good in theory, you will be not getting it. If you are only good in practicals, that is also of no use. Most of the students are attracted towards modern medicine because most of the things are practically seen there, but that thing will not work in Ayurveda unless you have good theoretical knowledge. You cannot master the practicals. So Acharya Sushruta rightly said, and this is the principle what we have to inculcate to become Samarthata. You have to be very good in both theoretical as well as practical aspect. So even we have another reference, यथा करश्चंदन भारवाही भारस्य वेत्ता न तु चंदनस्य एवं हि शास्त्राणि बहूनि अधीत्य च अर्थेषु मूढाः करवद्वहन्ति. So you know this shloka quoted by Acharya Sushruta. So not knowing the meaning of the read scripture is mere labor, that is fatigue, like carrying sandalwood by a donkey. And we feel that most of the Ayurveda graduates are following this. They don't know the essence of the Samhitas and they are attracted towards modern medicine. They read only the Samhitas for the sake of passing exams and to get degree. So these are all the problems already mentioned in our Samhitas, which we can see today also. Most of the students feel reading Samhita is of no use. Reading Ayurveda part is of no use. They are attracted towards modern medicine. So somewhere we are all part of this system. So instead of discussing lot of problems, we have to move towards the solution. So this is what we will see in the Shastra. And if you see in Sushruta, again there is a point called Shastranta. Anyone to reach the Shastra or to study the Shastra completely, a Shishya should be having four gunas. That is, he should be Gurupara, he should be Shuchi, he should be Daksha, and the most important thing, that is Tandra Nidra Vivarjita. I need not to say this in detail. Those who are all hearing to this session can assess themselves how much Gurupara they are, how much pure they are physically as well as mentally, how much Daksha, how much disciplined they are towards the Ayurveda studies, and most important thing, they are not Tandra Nidra Vivarjita. They are into this point highlights that our students are more into the comfort zone, and you cannot reach the shastranta with being in the comfort zone. So to move towards the shastranta and to study a shastra completely, you should be having these four qualities. And we might notice that many students are not Gurupara. If you say whatever good for them, they will not accept it. And today's generation students feels that they are smarter than everyone. So with this thought, they cannot be knowing the Ayurveda in deeper aspects, and they are not disciplined mentally. They study only for the sake of exams. Most of the students, if you ask, they won't be studying, they won't be interested into the concepts, and this has become a trend. I'm not speaking something false. I have traveled across India, I have met with students of different states, and even in our Karnataka, every student has this problem. They are all having laziness, as well as they try to be in the comfort zone. If any teacher makes them to come out of the comfort zone, that disturbs them. So this disciple with these qualities can reach the end of the science and learn completely. And if you ask any seniors who have achieved success in Ayurveda, they are still studying Samhita. Many have the habit of reading Samhita daily. There are people who won't have food unless they study one page of the Samhita, because they feel that this reaching Shastranta is not an easy task. This requires lot of experience as well as lot of time. But this has to be understood by our student. So what is the reality of the outcome of our education? So out of 100 students from an intern batch, probably not even 10 students are going for Ayurveda practice. And I'm not speaking about like only one state. If you go to all states, this is the scenario. Among 100 batch students, not even 10 students are going for Ayurveda practice, and few will do PG, and few will do duty in allopathy hospitals. And girls, if you see in Ayurveda, they are more in number, less in action. The meaning of saying less in action is we will get few female practitioners of Ayurveda in the society. But if you see, the number of graduates are more in girls, but the number of practitioners are less. Most of them are working in allopathy hospitals as duty doctors, and very few people will make stronger decisions to practice Ayurveda. And if you see boys, they're not serious during studies and they start worrying after being graduates. This is the biggest problem. Unless they get the degree, they're not serious about it. Once they get the degree, they will find what to do next. And this time, whatever makes them to feel easy, whatever shortcuts they can get, they will follow that. And that is nothing but practicing allopathy. So this is all the reality and the problem what we have seen. And Acharya Charaka has rightly said that partial knowledge is dangerous. So nahi gnana avayavena kritsne gneye vignanam utpadyate. Just mere reading a part of the subject will not be helpful to make you knowledgeable throughout the scientific concept. So nahi gnana avayavena kritsne gneye vignanam utpadyate. So partial knowledge is dangerous is what Charaka is saying. So till now, I have discussed all the problems, because we can also feel, whoever is listening can feel this is the reality in the Ayurveda. So what we have to do then? So Acharya Charaka says, when a physician who, even if well versed in knowledge of the disease and its treatment, does not try to enter into the heart of the patient by virtue of the light of his knowledge, he will not be able to treat the disease. So we are seeing that our students are not competent enough to treat so many diseases. They will diagnose as per modern, they will try to treat with Ayurveda, or they might analyze the things but they are not capable to treat the diseases. So we are seeing asamarthata, because they are not utilizing the knowledge and they are not even gaining the knowledge in the proper way. And we will get so many students who are very good in knowledge, but knowledge is power only when it comes in use. So knowledge without useless, if it becomes useless, then you cannot be gaining the power. And another quote I always say in all my sessions: if you learn methods only, you may get stuck at some point. Please listen to this carefully. This is very important quote. If you learn methods only, you may get stuck at some point. But if you learn principles, then you can derive your own methods. Why I am highlighting this is, most of our students, especially those who are doing internship, if you discuss with them, they're always interested in knowing the treatment protocols written by a doctor, why the medicine has been written, everything they will note, but they will lack in understanding the principles. They will merely follow the method of some lectures or some doctors, but they are not ready to learn the principles. In most of my guest lectures for first year UG new batch, I will ask how much time you require to learn the medicines for 30 diseases. Suppose if I give a list of 30 diseases, And if I mention two medicines for each diseases, how much time you require to buy at this? And they will say hardly within one day we can buy at these 60 medicines for these 30 diseases. Then if something you can learn in one day, why you are spending 5.5 years will be my question. Then I will be telling that this is to learn the principles and not the methods. So our Ayurveda is not like modern medicine. Ours is a holistic thing, and we have to learn the principles, and without principles you cannot treat patients. So sometimes you might get the good results if you follow the methods, but unless you know the principle behind how these medicines are working, how you have to diagnose the patients, you cannot be achieving success in all the diseases. So always I say, read samhitas and follow siddhantas. So most of the times we will read samhitas, that too for the sake of exams. And when it comes to following Siddhanta, hardly we follow Siddhanta in our practice. So don't think that I'm speaking a lot of negative things about Ayurveda. So we are into the process of finding solution for this, and we are into the process and we are doing it. So I will use some concept of Ayurveda to derive Asamarthata again. So, Nidana Panchaka for Asamarthata. You might be shocked, what point is this? So, it is not mentioned in any Samhitas. This has been designed by myself. So, if you consider Asamarthata as a Roga, then how we can design Nidana Panchaka for that? So, we'll see one by one. So Nidana is the causes, as you know. Hope most of the audience is Ayurveda students only. So you are knowing what is Nidana. If Asamarthata, not able to perform something, not able to having the competency in doing treatments. So what is the causes? So the first cause is lack of proper training and education. I won't describe this in detail, you know already, and insufficient clinical experiences. So if you see, most of the students are not even seeing 1,000 patients by their 5.5 years, and they want to start their practice. So unless you have a lot of clinical experience, you will feel a lot of difficulties. So insufficient clinical experience will also leads to asamarthata, poor time management and organization. So most of Ayurveda students are not organized in doing things. They are enabled, their inability to prioritize tasks. They don't know what to prioritize, and this is the biggest problem. During their studies, they prioritize something else, and once they have to start earning, then their priorities will change us. And when they do things unorganized, that will leads to problem. So this is one of the nidana, and they are not able to manage time effectively and maintain organized records and inadequate communication skills. So you can do best Ayurveda practice only when you have good communication skills, because a patient who is not having any knowledge about Ayurveda, if he has to undergo any of the Panchakarma treatment, has to be convinced first. Most of Ayurveda students themselves are not convinced about Ayurveda treatments. Then it is really difficult to convince a patient. You can convince a patient only when you have good communication skills. So whenever you are working in your hospital, in your colleges, the patients whoever comes are already convinced by some of the doctors. So you won't be learning that convincing skill and communication skills most of the times in the colleges. So you should be learning from some vaidyas, and you have to not just observe the medicines, rather you have to understand what is the way they are convincing. It is not really easy to convince a patient for basti. A patient will come with gridrasi complaint and he is telling that radiating pain is there in my leg, and you will tell him to go for basti treatment. He will be really shocked why they are treating through the anal route. I have problem in my leg. So they will be confused, and during such things only those who are having good communication skills can convince. And this is the biggest problem Ayurveda students have, lack of communication skills, which leads to a lot of problems and which leads to asamarthata and fear of failure and lack of confidence. I have already discussed. They have somewhere they have this thought, if I practice Ayurveda and if I become failure, so this thought will haunt them not to practice Ayurveda. So these all thoughts will ultimately leads to Asamarthata, and these are the Nidanas. So I also request everyone to design your own Nidana Panchaka for whatever problem you see in the life, just how I have discussed for this Asamarthata. So, what might be the lakshanas when you are having asamarthata? So, difficulty in diagnosing and treating patients. You will be not able to diagnose patient properly. You will be not able to treat patients, and inability to develop effective treatment plans. This we have to try with interns. Most of the times, if you ask them to treat a patient by themselves, they will be not having confidence, and they will be fearing what is the logic behind writing this treatment. They are not efficient to explain these things, so they are not having an ability to develop effective treatment plans. This will be the lakshana of asamarthata. So if somebody is having all these lakshanas, then you will be having asamarthata, and when you have asamarthata, that will leads to fear, and you cannot achieve success in any of the areas. And poor patient communication and education. So inability to effectively communicate with patients and educate them on their health conditions. See, compared to modern medical doctors, Ayurveda doctors are accepted more in the society because of their communication skills, and most of the times Ayurveda doctors try to educate patients with their lifestyle. So this is our skill, we have to inculcate that. And when you are having asamarthata, this will be the one of the lakshana. So you'll be not having good communication skills and increased stress and anxiety. If you inquire with students, they will be always in the anxiety that what will happen in the future, whether I will be able to earn money or not. So feeling overwhelmed and anxious when dealing with patients and complex health issues. If they get suddenly some rare cases, they will be frightened. So those managing skills are not there, and ultimately this will lead to stress and anxiety and avoidance behavior. Gradually, we start avoiding challenging situations or patients due to fear of incompetence. So most of the times, I have seen many people will do like this. When they are not competent enough, they will start avoiding the thing. And once they start avoiding the thing, they will be avoiding Ayurveda. And once they start avoiding Ayurveda, they will be interested towards other things which makes them feel easier. So these are the lakshanas we can see when somebody is having asamarthata. So the samprapti. So ultimately, because of this nidana, how this samprapti, like how we are developing the asamarthata has been designed here. So initially, fear and self-doubt, they start getting self-doubt and negative self-talk and self-perception. They will be perceiving so many negative things, and within them they will be thinking so many things which are not in reality, and they'll start feeling incompetence and avoidance and escape mechanism. So they will try to avoid. And I'm not saying something new here, these all things are mentioned in charaka. So avoiding these things, if you see the lakshanas of Chadmachara Vaidya, Siddhasarita Vaidya, whenever they deal with the original Vaidya, they will start feeling fear because they are not having the right knowledge, and they start avoiding things. So ಈ ರೀತಿಯ ಲಕ್ಷಣಗಳು ಆಗುತ್ತೆ. And lack of feedback and support, insufficient feedback and support from colleagues and mentors exacerbate feelings of incompetence. ಸೊ ಹೀಗೆ ಡೆವಲಪ್ ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಮೊದಲು ನಮ್ಗೆ ಭಯ ಆಗುತ್ತೆ, ನಮ್ಮ ಮೇಲೆ ನಮ್ಗೆ ಸಂಶಯ ಬರ್ತಾ ಹೋಗುತ್ತೆ, ಆಮೇಲೆ ನೆಗೆಟಿವ್ ಥಾಟ್ಸ್ ಜಾಸ್ತಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ, ಆಮೇಲೆ ನಾವೆಲ್ಲ ವಿಷಯಗಳನ್ನ ಅವಾಯ್ಡ್ ಮಾಡ್ತಾ ಹೋಗ್ತೀವಿ. ಗ್ರಾಜುಯಲಿ ಇಟ್ ವಿಲ್ ಲೀಡ್ ಟು ಬರ್ನ್ ಔಟ್ ಅಂಡ್ ಇಮೋಷನಲ್ ಎಕ್ಸಾಷನ್. ಮಾನಸಿಕವಾಗಿ ಖಿನ್ನತೆಗೆ ಒಳಗಾಗೋದು ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ. ಸೊ ಸ್ಟ್ರೆಸ್ ಲೆವೆಲ್ ಅಷ್ಟು ಜಾಸ್ತಿ ಆಗತ್ತೆ, ಫ್ಯೂಚರಿನ ಬಗ್ಗೆ ಭಯ ಬರ್ಲಿಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಗತ್ತೆ. ಆಮೇಲೆ ಸೊಸೈಟಿಯಲ್ಲಿ ಎಲ್ಲರ ಜೊತೆಗೆ ಅವ್ರು ಮಿಂಗಲ್ ಆಗ್ಲಿಕ್ಕೆ ಹೆದರ್ತಾರೆ. Because our engineering friends, all their engineering friends, everyone will be having good earnings, and they start comparing with others, and they start feeling inferior, and ultimately they will end up with avoiding everything. So some people will go towards allopathy practice, and this is how we can understand the whole scenario. Whatever I have discussed is the nidana, lakshana, as well as samprapti and anupashaya. So what are the aggravating factors? So high patient expectations. So unrealistic patient expectations and demands. Somehow if somebody survives this and start practicing, and if you are expecting unrealistic patient expectations, then it will increase the asamarthata. And complex and challenging cases, encountering complex and challenging health condition, and time constraints and heavy workload. So insufficient time and excessive workload. ಇದೆಲ್ಲದು ಕೂಡ ಜಾಸ್ತಿ ಮಾಡುತ್ತೆ. So all these points are aggravating the asamarthata. So lack of resources and support. So insufficient resources, equipment and support staff. ಸೊ ಈ ತರ ಇದ್ದಾಗ ಕೂಡ ನಿಮಗೆ ರಿಸೋರ್ಸಸ್ ಇಲ್ಲ, ನಿಮಗೆ ಪ್ರಾಪರ್ ಸಪೋರ್ಟಿವ್ ಸಿಸ್ಟಮ್ ಇಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ದಟ್ ವಿಲ್ ಅಗ್ರವೇಟ್ ಅಸಮರ್ಥತ. ಅನ್ಕ್ಲಿಯರ್ ಆರ್ ಕಾನ್ಫ್ಲಿಕ್ಟಿಂಗ್ ಗೈಡ್ಲೈನ್ಸ್. ಸೊ ಅಂಬಿಗ್ಯೂಸ್ ಆರ್ ಕಾನ್ಫ್ಲಿಕ್ಟಿಂಗ್ ಗೈಡ್ಲೈನ್ಸ್ ಅಂಡ್ ಪ್ರೋಟೋಕಾಲ್ಸ್. ಸೊ ನೀವೇನ್ ಪ್ರೋಟೋಕಾಲ್ಸ್ ಡಿಸೈನ್ ಮಾಡ್ತೀರಿ, ಗೈಡ್ಲೈನ್ಸ್ ಮಾಡ್ತೀರಿ, ಅದರಲ್ಲಿ ಕ್ಲಾರಿಟಿ ಇಲ್ಲದೆ ಇದ್ರೆ, ಸೊ ನಿಮ್ಮ ಥಾಟ್ ಪ್ರೊಸೆಸ್ ಮತ್ತೆ ರಿಯಾಲಿಟಿ ಪ್ರಾಕ್ಟಿಕಲ್ ಏನಿದೆ ಅದರಲ್ಲಿ ಡಿಫರೆನ್ಸ್ ಇದ್ರೆ ದಟ್ ವಿಲ್ ಅಗ್ರವೇಟ್ ದ ಕಂಡೀಷನ್. ದೆನ್ ಹೌ ವಿ ಕ್ಯಾನ್ ಅಲಿವೇಟ್ ದ ಥಿಂಗ್ಸ್. ಸೊ ಉಪಶಯ ಏನಿದಕ್ಕೆ ಅಂತ ಹೇಳಿದ್ರೆ ಮೆಂಟರ್ಶಿಪ್ ಅಂಡ್ ಗೈಡೆನ್ಸ್. ಸೊ ರೆಗ್ಯುಲರ್ ಗೈಡೆನ್ಸ್ ಅಂಡ್ ಸಪೋರ್ಟ್ ಫ್ರಮ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ಡ್ ಮೆಂಟರ್ಸ್. ಸೊ ದಿಸ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಡನ್. ಆಕ್ಚುಲಿ ಐ ಲೈಕ್ ದ ಕೋಟ್ ಆಫ್ ಆಯುರ್ಯಾನ, ದಟ್ ಈಸ್ ದೇಶ ಸುತ್ತು ಕೋಶ ಓದು ಅಂತ ಹೇಳಿ. ಸೊ ಮೋಸ್ಟ್ ಆಫ್ ದ ಸ್ಟೂಡೆಂಟ್ಸ್ ಆರ್ ರೀಡಿಂಗ್ ದ ಕೋಶ ಬಟ್ not traveling across the places. I had a habit of visiting Ayurveda doctors wherever I visit. So wherever I visit, I discuss with some of the Ayurveda doctors who are practicing there. If there is Ayurveda college, I visit the Ayurveda college. This helped me to understand the problems in a better way and how we can find the solution. So always mentorship and guidance is required with experienced people. So if you are a student who is listening to this session, please, whenever you go to your hometown or if you are in some different place, try to visit clinics and discuss with them what are the challenges they have faced when they are starting the clinic and how they have tackled it, how they have find solutions for it. Are they successful? Are they sustainable? Are they earning what they have expected? So when you discuss with experienced mentors, that guidance will be really helpful and this will help in reducing the problem. So ನಿಮ್ಮ ಅಸಮರ್ಥತೆಯನ್ನು ಕಡಿಮೆ ಮಾಡಲಿಕ್ಕೆ ಮೆಂಟರ್ಶಿಪ್ ಅಂಡ್ ಗೈಡೆನ್ಸ್ ಬೇಕು. And the whole session or the whole webinar what has been planned by Ayuryana is one of that mentorship and guidance program which might motivate you to practice Ayurveda by understanding the problem and finding the solution. So continuing education and training. So ongoing education and training opportunities. So now NCSM has also mandated Ayurveda doctors to attend CMEs and gain some points. Within 5 years they have to again renew their registration certificate, and for that, before doing that, they have to gain some points by attending CME because this is helpful. So have positive feedback and encouragement, regular positive feedback and encouragement from colleagues and mentors. So this will help in reducing the stress or reducing the asamarthata. So realistic patient expectations. You should be planning everything what is possible. If you are in a rural area and you are expecting patients as in Bangalore, or if you are expecting patients to pay the money as they are paying in Bangalore, it is really difficult. Unless you have something special, you cannot be doing that. So your expectation should be realistic. And self-care and stress management. If you learn the self-care and stress management, definitely this will help in reducing the asamarthata. So what is the chikitsa then? So till now we have understood the problem with the help of Nidana Panchaka of Asamarthata. Now what is the solution for this? The Chikitsa is by understanding the Nidana Panchaka of incompetence. Ayurveda graduates can better recognize the causes, symptoms and aggravating factors of incompetence and take steps to alleviate them. See, each student is not having same Nidana. So my presentation is focusing on making you realize where you are having the problem. So as we know in Ayurveda, the foremost treatment is Nidana Parivarjana. So unless you understand what is the cause of your problems, you cannot find the solution because all the students are having not same problems. So each of them have different problems. Somebody is from rural place and they has to support their family by making money. So if they are not starting making money, they cannot sustain their family. So you cannot be telling them that immediately you have to start Ayurveda practice. This is what making them not to practice Ayurveda. So please, after listening to this session, analyze the Nidana of your incompetency. If you are feeling that you are not able to practice Ayurveda, please find the reasons. Some might be not having the proper knowledge, some might be not having the proper resources, some might be not having the family support. Because I have some of my students who are ready to practice Ayurveda, but their parents are pressurizing not to practice Ayurveda and to start general practice. Even we have seen such students. So each student has different problems, and to find chikitsa you should be first understanding the Nidana. So just I have tried to make you understand in a different way regarding the Asamarthata. So as we know hetulinga aushadha, so first we have to know the hetu, we have known the linga, that is lakshanas. Now we are moving towards the solution part. Might be my session is prolonged because of this, but I have to also find the solutions for this. So solutions, as we know, if you see the Kaya Chikitsa paper, all the students will be writing this. Whatever disease might be asked is the Chikitsa Siddhanta, Shodhana, Shamana, like this. So in the same way, if you want to do Shodhana here, so forcefully expelling the thoughts. So mental detoxification is most important here. Techniques such as meditation, yoga, deep breathing to calm the mind and reduce stress. So first ಮಾನಸಿಕವಾಗಿ ನಾವು ಸರಿ ಆಗ್ಬೇಕು. So this Shodhana is not exactly the Panchakarma one. Here the solution is to understand by changing the thoughts and emotional release. Activities such as journaling, counseling and creative expression to release pent up emotions. ಸೊ ಫಸ್ಟ್ ನಿಮ್ಮ ಮಾನಸಿಕವಾಗಿ ನಿಮ್ಮ ಮನಸ್ಸಿನಲ್ಲಿ ಏನೆಲ್ಲ ನೆಗೆಟಿವ್ ಥಾಟ್ಸ್ ಇದೆ, that has to be forcefully expelled, and if you don't expel them you will be not able to get over the ಅಸಮರ್ಥತ. ಹಾಗೆ ಶಮನ ಅಂತ ನೋಡಿದ್ರೆ, ಸೊ ಹಾಗೆ ನಾವು ಅಲ್ಲೇ ಏನ್ ಸರಿ ಮಾಡ್ಬೋದು ಅಂದ್ರೆ ಕಾನ್ಫಿಡೆನ್ಸ್ ಬಿಲ್ಡಿಂಗ್, ಸ್ಕಿಲ್ ಡೆವಲಪ್ಮೆಂಟ್, ಟೈಮ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅಂಡ್ ಆರ್ಗನೈಸೇಷನ್. These are all the techniques to make yourself better by alleviating the asamarthata. So confidence building is the most important thing required for Ayurveda doctors. Really, I feel bad when I discuss with the students of government Ayurveda colleges. Than the teachers, they will follow the seniors, and seniors with some experiences feel that Ayurveda practice is of no use, and the same will be transferred to the students. But if somebody comes in between and guide them and boost the confidence of the students, definitely they are ready to practice Ayurveda. So this confidence building is most important. So whenever you discuss with students, they are always having lack of confidence. So we have to plan something to build their confidence. And the most important thing is skill development. So I'll be doing a lot of sessions majorly on the skill development. This is the solution. Unless you develop the skills, you cannot find the solution. So I have designed a quote: develop the skill or you might kill. Once again, I'm telling, develop the skill or you might kill. I'm telling this because we are dealing with the living bodies and not the dead bodies. So when you are dealing with the dead living bodies and you have not developed the skills of handling it, then definitely you might kill the patient. So most of the times, lack of confidence, negligence, all this is because of improper skill development. So even the skill development starts with identifying the skill lacunas. So all are not equally good in all the skills. Somebody is good in doing treatments, somebody is good in analyzing, somebody is good in diagnosing, somebody is good in treating. So each one have different skills. So more number of skills if you develop, the practice will be so good. So the skill development has been prioritized by the NCSM, and the whole syllabus has been designed keeping the skills in mind. And if you, as you know, there will be three different skills: cognitive skills and psychomotor skills and affective skills. For a doctor, more of cognitive skills is required along with affective as well as psychomotor skill. And Ayurveda is having lot of cognitive skills. That's why most of the things are explained theoretically, and you will feel some very few things are there practically to do, but even for writing a prescription, you require cognitive skills. So the skill development itself is a big topic. So this is not my adhikarana today. Today I am discussing on how we can make this asamarthata to samarthata, and one of the solution is skill development and also time management and organization. So once the time flies, it will not come back. So we should understand the importance of time. And during your student life, please try to get as much as skills from all the people around you. Don't think that this skill is of no use for me. Each and every skill is important. You need not to just observe what medicines a doctor is prescribing in the clinic. You also have to observe his communication skills, his convincing skills, his marketing skills. So like that, I have list of skills to be trained. And one good thing what we are planning in Aptas Ayurveda is that is skill enhancement program. So we are identifying different domains of skills, and we will be sending trainers to all Ayurveda colleges. And within 2 days of workshops, we will try to develop some of the soft skills which are useful for their practice. And you might be noticing that today across Ayurveda field, some of the treatments like Viddha Karma, Agni Karma, all these Marma therapy, these are getting popularity. And people, Ayurveda people are making good money by doing this treatment. Not just money, they are giving good result by doing these treatments. So these skills has to be learned for bettering your practice. So most of the time, students are not serious about developing skills. They will be knowing about that skill, but they will be not mastering the skill. There is a difference. Knowing some skill and mastering some skill has a difference. So this is not my topic today, but definitely will do this skill development program one day in this platform also. And the most important thing, that is sattva vajaya. This is mental discipline is most important. Most of the Ayurveda graduates as well as students have the problem with disciplining their mind. So mindfulness and meditation, this will definitely help. Regular mindfulness and meditation practice to cultivate mental discipline and focus. So most of the time we are having chanchala chitta. We are not having a accurate thought on what to be done after completion of your internship or after completion of your. Most of the students are having this problem. So you have to develop a positive thinking and affirmation, encouraging positive thinking and affirmations to reframe negative thoughts. So we have to remove these negative thoughts. This is nothing but sattva vajaya chikitsa, and these all things should be done in the student level. So we are having a lot of challenges as a teacher, because all teachers are not same. Everybody is not teaching in the same way. Student will learn by observing the society, by their seniors. Most of the times they are developing so many negative thoughts because of their seniors experience. Some senior has experienced some negative things about Ayurveda, and they will pass it on to juniors, and ultimately this will make not even 10 Ayurveda practitioners from a batch. And if somebody is daring to practice Ayurveda, most of their friends try to demotivate them. These are all the challenges. So we have to gain strength to face these things, and we have to develop a positive thinking among them. And the efforts whatever is taken place by Ayuryana is one of the sattva vajaya chikitsa for Ayurveda students. So those who are listening to this session, my my idea is to make you understand the problem in a better way, so that you can find the solution by your own. So by incorporating these principles, Ayurveda graduates can develop a comprehensive treatment plan to address incompetence and promote confidence, competence, and overall well-being thought patterns. So this is what I have for my session. So I have tried to explain the Nidana Panchaka of Asamarthata, and also some of the ways to make it as Chikitsa Siddhanta. So now I will be sharing some of the ideas by which you can excel in your practice. So we'll be stop sharing the screen. So further, I will be sharing some of the ideas what can be practiced, which are innovative, and we can bring a change in the society. So these plans are we are planning in the Aptas Ayurveda. So one of the plan is we have popularized Vamana treatment in the Vasanta Ritu. We have popularized Virechana treatment in Sharad Rutu for the healthy individuals. But when you read Charaka Samhita in the Matra Shitiya Adhyaya, they have explained Nasya. Nasya has to be done thrice in a year during Pravrut, Sharad, and Vasanta Rutu. But we have not popularized this thought among the common public. Leave about common public, not our Ayurveda students are also following this, including me. We have not developed this as a practice. You might be knowing that every Deepavali, everyone do the Abhyanga. That is how it has been marketed as well as practiced among public. So we are planning to introduce this Nasya treatment thrice in a year, once in Vasanta Rutu, then in Pravrut Rutu, then in the Sharad Rutu. As Charaka has mentioned, 7 times you have to undergo Nasya treatment. So now we are planning some initiative to popularize this thought. So those who are all hearing to this session, please go to your college office and request principal sir to plan something to do Nasya, at least for your college students or teaching and non-teaching staff. Now we are moving towards Vasanta Ritu. So you can fix a time and you can analyze who is eligible for undergoing Nasya treatment, and you can fix the dose of the Dravya what you are using for Nasya, and we can bring this concept. See, now we have Swarnamrita Prashana as a bread and butter of Ayurveda students as well as Ayurveda practitioners. So many people are earning good money with Swarnamrita Prashana, and definitely it has a lot of benefits. In the same way, we have to introduce Nasya. See, we are not in telling people to follow it daily. Definitely, it has been mentioned, but very few people will do this daily. At least we can make people to undergo Nasya thrice in a year, and this will help in Indriya Arogya. So the whole thought of Indriya Arogya I am presenting to you now. See, with this Nasya treatment, this is helpful for eyes as well as ears as well as nose. And now we are seeing most of the students are having gray hairs. If you see in colleges at the younger age, they are having gray hairs, and most of the students are having specs. At the early age, they are getting specs. So they are losing their Indriya Bala. So I request even the organizers, Ayuryana, to popularize this thought wherever they are practicing, and you can motivate other doctors also to start this Nasya treatment thrice in a year. This is one of the idea I want to share, which we are also taking lead, and we will popularize this throughout India. So like that we can, there are so many ideas and we can make our practice very good. See, we are not having good centers to treat Indriyas. Most of the times we are concentrating on Panchakarma and all. So we can start Indriya Arogya centers where a person can come on OPD basis once in a month or once in 15 days or once in a week and undergo these treatments like Karna Purana, Dasya as well as Gandusha, Anjana, Tarpana. These can be concentrated for healthy individuals as well. We are just concentrating on diseased patients, but we have to concentrate more on healthy people also. So we can bring this Indriya Arogya centers. So I'm just sharing one idea. I have a lot of ideas like that. And most of the time, our students are having issues with the marketing. So I have some ideas like you can fix your budget and you can have three different models. So a basic clinic model with 2 lakh and a standard clinic with 5 lakh and another model with 10 lakh and advanced clinic. See, whenever you are planning for starting your clinics, you should be understanding the population and the reach of Ayurveda among them. So you cannot be investing a lot of money initially. So we have to analyze the things priorly, then only we can be planning everything. So our students are not so good in analyzing. I'm not blaming our students, again and again telling so many negative things, but this is the reality. We have to train them in such a way that they can plan everything nicely. So Even you can utilize artificial intelligence. If you just type your thoughts in Meta AI, it will give you nice suggestions on marketing, how to market in this particular population place, uh, how to market in metropolitan cities. Each cities has different marketing strategies, each place has different thoughts. So unless you master all these skills, you cannot be good in practicing Ayurveda. So most of the listeners today are students, so I request all of you to understand whatever I have said, understand your problems, and please find solutions. Don't waste your student life. If you don't develop good skills in your student life, then you cannot be reaching many people, and gradually you might end up with bhaya. So my whole session is not to make you bhaya by showing how asamartha we are, rather to find solution by developing the skills and to reach this state of abhaya, and to develop our practice and to reach most of the people. So today the world is changing and people are looking towards Ayurveda, but we are not ready for that. So NCSM has brought a lot of changes in the syllabus, but mere changing in the syllabus will not help unless students involve themselves in the practice. So don't waste your student life. Try to gain as much as skills from wherever you can get, and please visit as much as clinics around you and inquire with the doctors, inquire the challenges in the Ayurveda practice. And we as a team, Aptas Ayurveda, are always with this motto, reach Ayurveda to each, are working for enhancing the skills of our Ayurveda graduates. So soon we are launching a program of skill enhancement for our Ayurveda graduates, and we will be visiting different colleges and we will try to enhance their skills. And those who are interested can join with this. And just passing the exam and getting the marks will not make you a good practitioner. So plan for your future wisely. So the whole presentation was the idea of Acharya Charaka. Said if you are not having samarthata, definitely it will lead to the bhaya. So most of the students were thrilled to understand what might be the topic. So the whole point is Nidana Panchaka of the Asamarthata and how we can tackle that. So to say something about me and Aptas Ayurveda, as the organizers have told me to share some of points related to my journey and how I could reach so many people. So this is the commitment towards Ayurveda, which is making not just me, I have a big team who are also committed towards practicing Ayurveda. And even in rural places, they are doing their practice and they are earning good money also. So don't have a fear that you are not competent enough. One example I will give, and then I will finish my session and will go to the question answer session. One of my student from a college where he couldn't learn anything related to Ayurveda. He just got a degree and he approached me, Sir, I want to learn Ayurveda and practice Ayurveda. Please guide me. Then I could manage him to send to different doctors across country. He visited different doctors, he stayed there, he learned skills, and he traveled for around 8 months for different doctors. I sent him to learn some marketing skills, I sent him to learn some panchakarma skills, I sent him to learn some vidya karma and agni karma skills. He traveled everywhere and he's just a BMS graduate. Then after 8 months he asked, Sir, where to go next? Then I said, please start your clinic. Then within 2 3 months, he could arrange to start his clinic in a remote area where nobody is practicing Ayurveda. And you might be shocked, his communication skill as well as his clinical skills were developed to such a level that he could earn more than 1 lakh in his first month of pure Ayurveda practice. So it seems not possible for all, but I feel very bad for those students who will not try and come to decisions by listening to others' experience. You have good experience as well, where they have developed good skills and they could earn good money also. I understand that most of the students have the problem with money. So to earn money, they will go for shortcuts. But please, once try with Ayurveda. If you have developed good skills and if you can give good results to the patients, definitely you will be having a lot of followers, lot of good patients you can do, and you can practice in even remote areas. So don't think that practicing Ayurveda is of no use. Definitely you can earn money, name, fame, and so many things with Ayurveda. You can achieve dharmartha kama moksha, as our shastra says. You can fulfill all your desires with the knowledge of Ayurveda. Only thing is you have to become competent. Unless you become samartha, you cannot achieve anything what I have quoted. So develop skills, not just theoretical skills, practical skills, communication skills, behavioral skills, how to convince patient, how to market your thoughts, how to market a treatment, how to market a idea. You have to be very good in all these things. And these days one more thing is popular: students themselves are making products, cosmetology products, and they are selling among them. So these all things will definitely help. So don't mock if somebody is doing good. Please try to gain as much as knowledge as skills when you are in the colleges, because the world is totally different once you go out of the colleges. So don't be in comfort zone when you are in college. Come out of the comfort zone and achieve success. So once again, I will end my session by quoting Asamarthata Bhayakaranam. So if you don't want to feel fear, be Samartha and then reach Ayurveda to each. With these words, I thank organizers of Ayuryana, Dr. Radha ma'am, for recognizing me, for initiating this webinar series with the topic Asamarthata Bhayakaranam. Hope I have fulfilled what they have expected from me. So now we can go for question answer session.
Sir, there are doubts in chat box, sir. Are you able to see those? ಕಾಣಿಸ್ತಿದೆನಾ ಸರ್?
ಸಿಗ್ತಾ ಇದೆ ಸಿಗ್ತಾ ಇದೆ. Must needed as always a unique way of explaining concepts. So thank you, sir, for organizing such a great event at Ayurgrama. This has increased my communication skills. So questions will read. So please explain what are the hurdles to overcome usually when a person starts a organization, and also solution. Okay, this is about starting an organization. So whenever you question is by Santosh Kumar sir. So whenever you start an organization, your vision should be very much clear, and the members should be connected with the vision. So most of the times, students are very thrilled to start something as an organization initially, but gradually they will lose interest when they are not connected to the vision. So to speak on Aptas Ayurveda as an organization, so all the team members are committed to the vision and not for any person. So we are all committed to reach Ayurveda to each, and everybody is connected with this motto, and everybody is ready to work for Ayurveda. So unless you have team members who can connect with the vision, you cannot start an organization. And even if you start, you cannot run it for a longer time. So please be clear about your visions and what you want to do, and you should be having everything in writing. Most of the times our students are very good in imagining things. They have a lot of thoughts in their mind, but when it comes to action, they are having a lot of failures. So many are having ideas to start hospital, many are having ideas to start a clinic, but they are not successful because of having all these asamarthatas. So even to start an organization, you should be having good communication skill, and you should be not having the bossism kind of things. So if you see in Aptas Ayurveda, we treat everyone equally. We don't have any posts in Ayurveda. We don't have posts like president, vice president, and all these things. Everybody is having equal importance, and everybody is happy in doing their area of work. And we should be assigning the works as per their area of interest. So definitely starting organization will be fruitful only if your intentions are good. And if you want to make money, definitely you can do that, but not with the organizations. So if you start organizations with the motto of serving the society, definitely even you can make good name as well as fame. So you can reach to the people. And the most lacking thing, what I observed when you start an organization is innovation. So you will be reaching to people only when you are innovative and if you are unique. If you are doing the same thing what others are doing, then your reach will be less. So I can be speaking a lot on this organizational skills, but I will just conclude this point and take other questions by quoting that please be unique and try to find the points which are not touched by anyone. And definitely you will be reaching within no time to all the thing. You can become viral, you can become a trend when you do things. As some of the students have mentioned, Ayurgrama, so some students is mentioned that thank you sir for organizing event and that has helped me to develop communication skills. So as Ayurveda was first of its kind and nobody has done, it could reach. So that's how you can be very popular as an organization. So we'll move to the next question. And in that question also has been asked about hurdles and solutions. Hurdles definitely is to make a good team. And if your team is good, definitely you will be having solutions. And before starting, don't have this competitive mind with other organizations because everybody is having the same vision to connect Ayurveda to people, but the ways are different. So don't feel if somebody is doing good, they're competitors. This is not a competition. Everybody is having the same vision. So with this motto, if anyone approaches us, Aptas Ayurveda will be always ready to associate with others and to carry works. So this is how you can come out with the hurdles as well as solutions. So this is a big topic. We'll discuss some other time. Hello, sir. Main reason our generation BMS graduates lack confidence in practicing Ayurveda is lack of guidance. Every Ayurvedic practitioner set their own secrecy in their practice. I feel when our acharyas themselves have not made anything as secret, not be doing that. So all the knowledge, whatever we are also having, is by the samhitas. When our acharyas didn't made it secret, then why we should be doing? But what I feel is instead of blaming somebody who is doing such secrets and all, you can be reading samhita, and definitely it will show you the path. So don't think that you need someone to guide you for such things. If you start reading Samhita with your own idea, with your own experiences, lot of sources available in YouTube. You can derive your own methods. So don't go behind methods. That's what I highlighted in my presentation. If you go behind methods, definitely you might stuck at some point. But if you learn principles, if you learn through Samhitas, definitely you won't need the secrets of others. You can design your own secrets, you can design your own methods. So namaste sir, how to conduct health camps, please give a gross idea. So regarding this, I am not in support of organizing health camps. Rather I prefer health awareness camp, because most of the time the affordable community will not come for the health camps where you are distributing free medicines. But instead of that, if you do health awareness camps where you are interacting with people, where you are convincing people to follow Ayurveda, to understand Ayurveda, that will help you to increase the patients. So most of the times doing health camp has the purpose of increasing the patients, and instead of distributing free medicines, whatever we give free is not valued most of the times. And remember this, most of the times the affordable community who can afford the Ayurveda treatments will be not utilizing and will be not visiting these health camps. Instead of that, create health awareness where you will be delivering a lecture on Ayurveda concepts, and I have followed the same, and that has helped me to increase the patients as well. So generally, we don't do this medical camps from Aptas where we are giving medicines and all. Instead of that, information itself can be marketed very nicely, which will make them aware to follow Ayurveda. So this is my personal thoughts. Need not to follow that. But if you want to definitely do health camps, you can be associating with some of the pharmacies and to give medicines. But most of the times, giving medicines for a short span of time will be not useful. So that whole entire concept has a different advantages and disadvantages. So hope this is enough for this session. So in cities like Bangalore, it's very expensive to set up own clinic to practice. What are other platforms to practice pure Ayurveda other than colleges? Please educate about job opportunity to practice. So most of the time we cannot be expecting that somebody will create a job for me. So our profession is like that. I have to give job for myself by utilizing the knowledge, and I have to start my own clinics. So definitely in initial days, you might feel difficult to start your own practice with your own clinic. So before that, please try to work under some doctor who is practicing Ayurveda in a clinical setup at least for 6 months to understand the marketing strategies, to understand the amount required for that. Because to start in Bangalore and all, you have to be having a digital presence, or you should be present online. So you have to be known to people, or else it is very difficult to find you in cities. So you should be popular, you should be having a good name and fame. So then only you will attract patients, because cities like Bangalore has a lot of different marketing strategies, and you can get all these points in Meta AI. So as time is less, I'm not explaining in detail. Just go to Meta AI and type this question: how to set up a Ayurveda clinic in Bangalore. It gives good suggestion than us, because AI knows what are the challenges in the Bangalore city, what are the marketing strategies. So definitely that will be a good idea. Please follow that. Thank you for the educative session, Doctor. Sir, is there any government support or funding for pharmacy or herbal garden cultivation? So government is directly not supporting for pharmacy, uh, but for if you want to start a 10-bedded hospitals in MSMI, so small Ministry of Small and Medium Industries is having some protocols where they will be providing some loans without interest, where you can start the 10-bedded hospitals and all such Ayurveda things. But for pharmacy, it requires huge amount investment, at least 50 lakhs plus you require to start a pharmacy. I don't have that experience to share the ideas, but I know some people who can guide you in a better way and the challenges of starting a pharmacy. But government is not supporting in initiating the pharmacy. There are a lot of protocols, and most of the students are not utilizing the opportunities given by government also. And definitely, we can be doing a session by some people who know this on what are the facilities given by government if you want to start your own session, own practice. So herbal garden cultivation, I don't think government is directly supporting for that, but you can be marketing. There are so many pharmacies which is ready to take the medicines by checking the qualities. So before starting that herbal garden cultivation, you should be knowing the buyers. If you don't know the context of buyers, and if you grow the medicine, then most of the times it might lead you to loss. So the whole strategies of marketing is totally different. So whatever you cultivate, before that you should be having the buyers. And sometimes these pharmacies are themselves are funding for growing the medicinal plants. Such things are also available. So as Ayurveda is said to be slow, how can we decide to jump to Ayurveda practice, and financially also difficult to maintain if only Ayurveda is practiced? I don't think Ayurveda is slow. Body requires its own time to heal itself, and Ayurveda or any other Pati or any other medical science will support this healing system. So I don't think it is right to say Ayurveda is slow, because, as I always say, this is not being rude, but you cannot get a baby in 3 months. If you want to get a baby, you have to wait for 9 months, because that is the process. In the same way, Ayurveda prioritize Shuddha Chikitsa. So whatever medicines we are giving for patients, our aim is to not create any adverse effects by the medicines. But if you see other systems, they are not Shuddha Chikitsa. If you go to Google and type any allopathic medicine, it will come with lot of side effects. Even Ayurveda medicines, if not used properly, can cause side effects. But most of the times, Ayurveda medicines are having side benefits than side effects. So we have to convince people that treatment should not be slow or fast. Rather, it should be done in such a way that the disease should not reoccur. So our target is not to treat patient in a very speed manner. Rather, our target is to make it clear so that he should not be getting it. So the word is apunarbhava, what is mentioned in Shastras. So that person should not suffer with the disease again. So apunarbhava is our target, and definitely we can develop some protocols for speedy recovery. If patient is understanding the ideas, understanding the Nidana Parivarjana, definitely we have seen results are within less time. So speed we have seen the results if the patient is ready to follow Pathya and Apatya. So we cannot be changing our protocols for the comfort of patients in that way. If something has written in Shastra that we have to do like this, we have to follow the same method. We cannot be adjusting it. But these days we feel very sad that in metropolitan cities like Bangalore and all, people are doing panchakarma in a very different way against the classical rules, but for the patient's comfort they are doing. But the same patient will be coming again and again with the same problem. This is also has to be discussed. So this is all my thoughts on that point. So according you, those uh, college name UGPG done matters for further job. It is not UG or PG college what matters. It is the amount of skills you have. If you are able to showcase those skills whenever you join any colleges, definitely you have wide acceptance. So I feel the skills matters, not the colleges. And if some college is giving the skills in a better way, definitely those who are job providers will prioritize those colleges, because the society knows, the job providers knows which college is giving the skills in a better way. So when they know the reality, it is really difficult to say that skills matter. Sometimes the college name also matters, but if you can showcase your skills with your innovative ideas, then definitely any college will give you job, or any opportunities can be achieved with your knowledge. So please give the guidance about skill development, sir. Is there any study material which guides skill development? So there is no exact any material for skill development, but what I feel is you can go to Google or you can study in Meta AI what are the skills required for an Ayurveda Vaidya, and people get that skill. So we have to utilize this Meta AI, because these days many are using it, and even Ayurveda students also can use it. But mere having knowledge on skill development is not possible by reading any books. You have to identify what skills you want to gain, and from where you will get that skill, and how much time it requires to develop that skill, and how much dedicated you are to gain that skill. Only these things will matter. So as I know, there is no particular book. I have initiated to start writing that book, but I couldn't complete it yet. So I am in that way to write the book on skill development in Ayurveda, because most of my presentations are on skill development. So is PG essential for Ayurveda career, sir? So I feel personally that PG is essential considering the challenges we are having in the future. So if you don't want to feel out that uh, uh, then you have to do the PG for sure. But there are so many examples in society without doing PG also they are earning, they are having good name and fame. But if you want to enjoy this administration, if you want to work in this Ayurveda education sector, PG is mandatory. If you want to really serve the people by treating patients, then your BAMS is enough only when you have developed the right skills. Most of the time, interns join to PG because of lack of skills, and in within 3 years of their post graduation they will develop a lot of skills. So it depends on the amount of skills you have developed. If you have not developed the skills, definitely you can join PG and develop skills before going to the society. This is how I feel. Again, this is an like we cannot conclude that this is essential or not, because we have all sort of examples for this. So, sir, as you said, comparing rural and urban, we will see difference either in financial and other things. Can you bring in some light on this? How to focus and establish Ayurveda in rural areas? See, to develop clinics in rural areas, first thing is you have to convince people. So instead of directly starting with the clinic, you could be reaching people with your knowledge and you guide them, educate them, and you can show them the results. Because I have to give one example. There was a folklore practitioner near Sagara, that is Narsipura, Anandapura Khatra, near to my place also, Shikaripura. So Narayana Murthy sir was treating blood cancer and he used to get patients throughout India. Even some foreigners used to come. So this shows that if you have something which is very unique, then you can get patient wherever you are. So that is how unique you are in your practice, how specialized you are in your practice. You can see that in most of the places, after allopathy, they are going for folklore practitioners than going to Ayurveda doctors. So the second priority is folklore practitioners, and they're all in most of the rural places, but patients will go. So that is how you market yourself and how much skills and specialized you are. That's what matter when you practice in rural areas. Again, that requires a lot of things to set up a clinic in rural area. You cannot be investing a lot of things initially. Gradually, you have to start. Gradually, you have to show results, and then you will develop patients. It will definitely require time, but if you are unique in your rural area, people will come. And the example what I gave for my students, he was also in such an area where people are not going for Ayurveda, but he was able to convince with the results. He used to convince patients with his treatments. That's what made him to practice nicely. So definitely we can plan. So if you need any guidance, if you want to start a setup in rural places, definitely we can give you some models. You have different models how you can start in different areas. How and what to choose after BMS on basis of individual thoughts and vision. How and what to choose after BMS on basis of individual thoughts and vision. That again depends on your priorities. So for some students, money will be the priority. For some students, there won't be pressure of making money. Rather, they have thoughts of making name and fame. Some want to do unique things. Some want to do innovation. So based on their priorities, they have to choose that. But before choosing, definitely you can have a interaction with somebody who is working in this field and get thoughts. Ultimately, it depends on your priority. So main problem is even if we are ready to practice Ayurveda, nobody is ready to teach us fully how to deal with this. So today the situation is not like that. Many are ready to teach Ayurveda, especially the youngsters who have started practice and gained success are ready to share their knowledge. Definitely you can visit them. You please contact me. I will be guiding you on where you can gain the knowledge and where you can get the ideas also. So job they offer 15 to 25,000 even after 2 years of experience. Is it correct salary? See, if you are expecting salary, that itself is wrong, is what I feel, because you cannot manipulate job providers. So most of the times these job providers are not Ayurveda doctors. So job providers are from other fields and they have monopoly there. So they will decide what has to be done. And if you are working in allopathy hospitals, then I am not speaking on that because I don't support that. But if you really start Ayurveda practice, definitely you can earn more than that if you have right amount of skills. See, if you can do Panchakarma treatments for at least 5 to 6 patients in a month, you can earn more than that. So it requires ideologies and strategies. So I don't know, 15 to 25,000 what you have mentioned is for either clinical setups or for allopathy setups. So I don't think that is the right salary. That is the worst salary anyone can get after studying 5.5 years. You can earn more than that by working in some other fields which don't require this much of knowledge. So that is not correct salary, but we cannot be demanding that unless we are united. So when all the Ayurveda graduates are united and demand, then definitely changes can be brought. But there is lack of unity. If somebody is leaving job by seeing this much of salary, another person is ready to take over that job. Because of lack of unity, we cannot handle this, but we can earn more than that with our own practice, is what I can suggest here. Sir, also, is it necessary to reach these principles for parents and many teachers who should support students to practice Ayurveda? Definitely, this has to be reached to parents, and I have seen some people are convincing parents also, especially in graduation day. We can be utilizing this opportunity to convince parents. So, whenever in graduation day, you can be showing the parents the examples of successful Ayurveda practitioners, which will motivate them to support their kids to practice Ayurveda. And teachers also has to be motivated. Both are required. So, since many of the Ayurvedic medicines are costly compared to allopathic medicines, how can we convince them to take our medicines, sir? So, you need not to prescribe costly medicines, and this is a myth. So, what I have always felt is the amount what we spend for these investigations, with that amount, you can completely treat the patient. So, most of the times where I was practicing in Haveri, I used to not write any investigations. And patient used to ask, sir, you please write investigations. Then I said, within that money, you can get treatment here. Then why I should waste the money? So we should understand that if you develop your clinical skills to a good extent, then you will be not depending on the investigations. So I don't feel Ayurveda medicines are costly and people are affordable. So this is a myth we ourselves has to create, because such myths are created by us only. People are ready to spend money to get treatments. So whenever they are in trouble, they are ready to get all the treatments, get all the medicines. We can treat so many diseases with uh, not costly medicines also. So again, that has some conflicts of thoughts. I cannot be saying exactly in this way, but it is easy to convince if you give the result, because many of them who are not studied Ayurveda and in the name of religion they are practicing Ayurveda, they are charging more money than the Ayurveda doctor, and people are paying there, and they are ready to pay 10,000 for this different scanning as well as all these treatments. For allopathy, they are not having such a thought. When it comes to Ayurveda, people have this thought. So we have to eradicate this thought by convincing them to take medicines. And definitely, we can convince if we give the results and if we make them understand the concepts. So when a practitioner feels or decides to practice Ayurveda after getting failures in general practice with improper or lack of knowledge, what things he can do to get himself better in basics and practice. So today many colleges are running some courses. So if you come to SDM College of Ayurveda Hassan, you have course on anorectal surgeries, you have that is Shara Sutra course is there, you have Panchakarma course of 1 month where they will be training all these things, and you can improve your practice. You can come back to the courses where they are guiding all these things. Many events are being taken place where the practitioners who have practiced allopathy for several years can again practice Ayurveda. So you can use such opportunities, and you can be visiting our college, STM Hassan. Here we have all systems to guide you in that way. So you can also visit so many courses. You can be visiting the website of RAV. RAV, that is Rashtriya Ayurveda Vidyapita, and they have enlisted the courses. They have a certificate called ATAB. So courses are certified with the ATAB, and if you can learn those ATAB courses, there are more than hundreds they have enlisted in their website. RAV website ಅಲ್ಲಿ ATAB ಅಂತ ಕೊಟ್ಟರೆ ನಿಮಗೆ ಸಿಗುತ್ತೆ. ಸೊ ಆ ಕೋರ್ಸಸ್ಗಳನ್ನ ನೀವು ಜಾಯಿನ್ ಆಗಿ ಆನ್ಲೈನ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಆಫ್ಲೈನ್ ಆಗಿರ್ಬೋದು. ಸೊ ಎಲ್ಲದಕ್ಕೂ ಕೋರ್ಸ್ ಇದೆ. ನೀವು ನಾಡಿ ನೋಡೋದು ಕಲಿಬೇಕಂದ್ರೆ ಕೋರ್ಸ್ ಇದೆ, ಮರ್ಮ ಥೆರಪಿಗೆ ಕೋರ್ಸ್ ಇದೆ, ವಿದ್ಯ ಕರ್ಮಕ್ಕೆ ಕೋರ್ಸ್ ಇದೆ, ಅಂಡ್ ನಿಮಗೆ ಡಿಸೀಸ್ ಪ್ರೋಟೋಕಾಲ್ಸ್ ವೈಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಕೋರ್ಸ್ ಗಳನ್ನ ಗೈಡ್ ಮಾಡ್ತಾರೆ. ಡಯಾಬಿಟಿಕ್ ರಿವರ್ಸಲ್ ಗೆ ಅಂತಾನೆ ಕೋರ್ಸ್ ಇದೆ. ಪ್ಯೂರ್ ಆಯುರ್ವೇದಿಕ್ ಅಲ್ಲೇ ಹೇಗ್ ಮಾಡಬಹುದು, ಎಲ್ಲದಕ್ಕೂ ಕೋರ್ಸ್ ಇದೆ. ಯು ಕ್ಯಾನ್ ಬಿ ಯುಟಿಲೈಸಿಂಗ್ ಆಲ್ ದೋಸ್ ಥಿಂಗ್ಸ್. So thank you, sir. It was a useful session. Start clinic, it's 1 lakh of 1 lakh of experience, rent, salary, etc. But patient is not ready to pay 1,200 for Abhyanga. They choose allopathy as it's cheap and instant results. No need to change lifestyle. See, this has to be convinced, and you cannot be charging like 1,200 and Abhyanga if the setup is very poor. So what matters is the ambience of your Panchakarma theater, ambience of your clinic. So in Bangalore and all, I have seen the ambience is designed so nicely that patients are ready to pay even 2,000 for an Abhyanga. They're ready to pay 1,000 for Abhyanga. But again, that depends on the ambience you create. And again, there are so many points related to it. That discussions goes on. Is there anything which is available free is not respected or not considered? Sir, is doing PG in Panchakarma and starting my own Panchakarma center is good choice. I have done my internship under proper Ayurveda practitioner and practicing in a private Ayurvedic hospital now. So I don't think you need to do Panchakarma post graduation if you're already having those skills. If you don't have those skills, you can be doing that post graduation. Instead, you can select some other departments also, or Panchakarma. PG is really good. Many are doing successful practice. You can start your Panchakarma center even without having the post graduation in Panchakarma, because many UG students who completed BMS are starting their Panchakarma centers and giving good results without any post graduation. So I'm not defaming that Panchakarma PG is of no use. Definitely it is of use and you will be mastering the Panchakarma skills. But if you have already imbibed it by your college or you are working under some practitioner, I think you can start your Panchakarma, this one. But you have to be very careful on the complications and how to handle them. Then that's what the difference we see with other people and Panchakarma PGs, as they have seen more than thousands of Vamana, more than thousands of Virechana, Basti and all. So their knowledge will be developed to such an extent that they could handle even the complications. So definitely you can be doing the PG, but I'm again having both opinions for this point. You can be doing both. It depends on how much amount you have developed the skills. Then to run a clinic for maintenance need 1 lakh monthly. Patient, this I have read already. Camps like Dudabala from Apta's team inspired a lot of youths like us. Thank you, sir. We'll be remembering the lessons from that camp. Thank you so much, Yashwant, for your comment. So, how to get complete knowledge about emergency management through Ayurveda? Now, again, I have different thoughts on this. uh, I don't feel that if somebody is treating emergency cases only is the good doctor. Definitely, we should be having knowledge on treating emergency also. But I think in treating emergencies, allopathy is very good and they are doing good in that. We can be learning those things. There are some courses also, but I don't think how much legally we can practice all those things, whatever we have studied through that. As a doctor you should be knowing that, I agree, but through Ayurveda we have to develop some of the protocols for treating emergency, or else already allopathy is good, we can refer to them. We can be concentrating on the diseases what we are good at. I'm not denying the fact that you should not be knowing emergency treatment. Definitely you have to learn emergency, but I think if somebody is already good in that, we need not to worry for referring. Definitely we can be referring, but if you are really interested into developing such things, I have seen some of the groups in Kerala who are developing protocols for treating these emergency conditions and what has to be done. For some cases, we are really good in treating even in emergency also, but not in all the cases. So complete knowledge about emergency management through Ayurveda, I don't think we have complete thoughts in every aspects. We have to develop, I feel. So definitely one day that will be there. And if you follow this Rasa Hridaya, there's a page in Instagram. This team is from Maharashtra. They have developed an emergency kit where they have identified the medicine which has to be used in emergency and what can be done. You will get that video. You can purchase that emergency kit also. But I don't think you can treat all the things unless you have the proper knowledge. So that has to be developed. But there are things related to Ayurveda emergency treatment. So dear already, audience, already it's time. This is the last question. So please do let us know how to reach you for any guidance and support. So please take my number, or you can go to Aptas Ayurveda page in Instagram or in Facebook, or you can text us in WhatsApp also. So I will be sharing my phone number in the group. You can be discussing with me with your ideas. So we as a team Aptas Ayurveda are into the innovative aspects of Ayurveda. So soon we are initiating this concept of Indriya Arogya by doing this Nasya thrice in a year. So those who all have listened to this session, please start initiating the programs to do Indriya Arogya. You might be seeing Lenskart has almost like their shops in almost all the big cities as well as the bigger places. So people are having so much of eye disorders. That's why so much of marketing has been for Lenskart and such brands. So if we could connect with them, and if we could bring something with Ayurveda to treat these disorders and to prevent these eye disorders, then that will be the biggest contribution through Ayurveda. So this is just one idea about Indriya Arogya. We have a lot of such things. We can have a discussion. If you also have some good ideas, we can have an interaction and we can find these challenges. Please develop a protocol. So whenever you have some challenges, to tackle them, first understand the problem. That's what I was intended to tell with my session. See, most of the times Ayurveda students are discussing only problems rather than discussing on the solutions. So please change this negative thought into positive. Discuss on problems and stop it, and then start discussing on the solutions also. Here we have solutions for most of the things, but we'll focus only on problems, and we keep spreading the problems. We keep discussing the problems. If you go to any colleges, if you discuss with seniors, everyone teaches about the problems, but only few are into finding the solution. And I really feel happy about Ayuryana initiated by Dr. Radha and Dr. The Santosh sir. They are really doing good work by presenting Ayurveda in a different way to the society. And we are also in the same path of reaching Ayurveda to each. So definitely this webinar series is a good initiation to reach most of the students, to develop confidence, to do Sattva Vajaya Chikitsa, and to find solution for different problems. You can discuss with us anytime about your problems. We will help you. So with these words, I conclude the session. So thank you, Dr. Radha and that whole team of Ayuryana, Dr. Meghana, Dr. Ishwari, and all the team, and Santosh sir, for giving me this opportunity. Hope I have justified with your thoughts and have answered questions as per my knowledge. If I have done any mistakes in explaining, please forgive me. So whatever good I have said is dedicated to the acharyas, the samhitas, and whatever wrong I have said is my mistakes. With these words, I conclude the session. Thank you, Anand.
Thank you very much, sir. I'm still reeling from the mind blowing session. The insights shared were not only impressive, but also empowering, motivating us to think in a new directions. A heartful thanks on behalf of the team Ayuryana. Thank you so much, sir. A huge thanks for the gratitude to the entire Ayuryana team for organizing this incredible webinar. Your efforts, both direct and indirect, have made a significant impact. A special thanks to Dr. Yashaswini for the technical support. Dhanyavad to each and every one of you. Thank you, sir.
Thank you.